Hello, everyone. My name is Charlene Hunt, and for my final presentation for MPH 581, I would like to discuss CASE4Cancer, which stands for Communication in American Indians Through Strategies for Equity for Cancer. Now I'm going to start with the project overview. The purpose of this is to address the cancer-related health needs of American Indian communities in North Carolina and also upstate South Carolina. The aims for this would be to implement a culturally tailored communication campaign for tribal communities. And we would do this in the catchment areas I discussed, North Carolina and upstate South Carolina. And this would be to improve health literacy, also to increase awareness about cancer screenings and promote preventative lifestyle behaviors. The second aim is to develop a tribal liaison program for continued local cancer education and screening support to also increase awareness, knowledge, and participation in cancer knowledge by linking American Indian communities to evidence-based cancer screening and tobacco cessation. The focuses of cancer would be lung, colorectal, head and neck cancers, and tobacco cessation. And one of the ways we would do this is through a multi-channel communication strategy. Most American Indians, Native communities, Indigenous communities were storytellers. So we would do this through visual storytelling, tailored PSA style videos, public service announcements, and tailored culturally appropriate print materials. Do this through brochures and infographic and complement this by social media. If you can look at figure 2, this is a framework for equity-centered health communication, and it talks about this multi-channel communication strategy. And this is the team that would help with this project. As you know, with any project you're trying to do or any type of community work, you need a really good team to help you. You need to think about the experts that you have within your institution, within where you work, within your community that can help you. So this is who makes up the team. And some of the activities for this project would be, first of all, we would need to develop a cohesive dissemination plan. And within these Indigenous communities, one way to do that is to expand the in-person community outreach activities. We want to disseminate culturally appropriate content through social media accounts and disseminate the video PSAs through our tribal partners. And we're going to collaborate with the North Carolina Department of Health and Human Services, their Tobacco Prevention and Control Branch, and also the North Carolina Department of Administration, the Commission of Indian Affairs. So they can help us with all of the materials that we create to disseminate these out to the community. And we're going to leverage collaboration with our community partners. We also need to identify, engage, and train the tribal liaisons so there's sustainability with this. So we will collaborate with the North Carolina Commission on Indian Affairs with their Center for Disease Control. And these tribal liaisons have been hired part-time for different priority tribes here in North Carolina. We want to train these tribal liaisons to increase their scope to include cancer prevention and screening. And we would also like to incorporate a mobile lung screening unit to connect the messaging that we're trying to provide to the North Carolina tribal communities and upstate South Carolina. And here are some of the impacts. The impacts, we are hoping to increase cancer screening to decrease the number one cause of mortality in the American Indian population. So with more screening, we hope this decreases the number of cancer-related deaths. We would also like to increase culturally appropriate tobacco cessation to help eliminate tobacco-related cancers within American Indian communities. and create a lay health worker tribal liaison program to continue this cancer education and screening beyond the actual grant period, and to finally introduce the mobile lung cancer screening units to the American Indian tribal communities. And we want to partner with the North Carolina American Indian Health Board. And one of the reasons why we want to do this is because we want to get their help and their expertise, and it's critical to the development of this. We need them to serve in an advisory board compassion, so they can help us with this process to let us know that our content is relevant, that we are to help us review the communication materials to make sure we're being culturally appropriate, to make sure the topics we're talking about are the topics that the tribal communities feel are needs within their own community, and to help us implement this program, to help us disseminate the educational information and the PSAs that we're able to create. And here are some examples of previous PSAs and a patient cancer story, that feel free to look at these whenever you have time. And here's an infographic that we feel is culturally appropriate for these tribal communities. We took into account the colors of the four directions, the yellow, the red, the black, and the white. We have different types of lung cancer screenings and when you need to do these, and how it's important to speak up for your health, to know that you are the advocate for your own health, and to remind these tribal communities that if you don't know, just speak up and ask. Now, we also understand that the support of the community is also our experts. So we want to have focus groups asking the community about key subjects, key topics, that we need to focus on. So this will help us when we are tailoring our messaging to the community, and it will also help us when we're creating our culturally appropriate educational materials and these PSAs. We want to know what type of communication or media is beneficial to the community. Do they prefer brochures, video, social media, in-person events? So when we're creating these things, we are understanding the needs of the community. And this would be the end of my slide. So I thank you very much. And it's been a wonderful semester with all of you, and I wish you much luck and success in your future endeavors. And the last slide would be my references. Thank you.